Well, my mom's often asked me, what do I need to do? How do I prepare for a Caesar? First of all, you need to make sure that you trust your doctor and you've found a doctor who you feel safe with. Secondly, make sure that your doctor will be the one performing that operation, because sometimes if it falls in holiday time or a time that they're going away, it may be someone else. So ask them, will you be here during that time? Because you really do want to be with someone that you trust. Secondly, when you're going in for a Caesar and you might be a little bit anxious, ask your doctor if you could be first on the list. Being first on the list means that you don't have a long waiting time from when you arrive at the hospital. It also means that you've got the rest of the day to be with your baby and visitors, because most medical aids will only cover a certain amount of time in hospital, so being early is always a good idea. Thirdly, you may be asked to prepare the area where the wound dressing is going to be. So just the upper pubic area, you might want to have a wax beforehand with someone really good at doing waxing. We don't want any sores or open areas, otherwise the surgery won't go ahead. So if you do decide to wax or to shave, make sure that you've done it in a way that is really, really safe and not causing any burns or little nicks. Fourthly, when you're going in for a Caesar, you don't want to have a heavy meal the night before. It's much better to have something light and to get to bed nice and early so that you're ready for the next day. Have your bags packed, have everything organized as much as you can. If you've got a second child, see that someone has been arranged to come and collect that child so that you can just have time to just be together with your partner and just not worry too much about those things. When you arrive at the hospital, very often you'll be asked to go through to the room, lie on the bed and be put onto a CTG monitor. Usually they just want to hear that the baby's heart rate is good, and during that time they'll be asking you lots of questions and signing a consent form. If you do have questions beforehand around the surgery and you feel in any way that you haven't been prepared well, it's best that you call your doctor to chat about it. The kind of things that you need to know are, will my baby be given to me straight after the surgery? As with an elective Caesarean section, it's very possible to do a skin-to-skin Caesar. This is the conversation that needs to be had beforehand. Are you okay to have the baby put straight onto your chest, even if there's a little bit of blood? If you're very squeamish, you might not like that. So talk to your doctor about having a skin-to-skin Caesar and what that entails. A lot of the times the babies need to be taken away just to be warmed up. The theatre is quite cold, and if this happens, they will not take your baby far. It's usually just next to the bed, just in the same room, under a crib, and the pediatrician and your partner can then go straight to the baby and just warm him or her up and give a little bit of oxygen. Occasionally that does happen. Babies at birth are often a little bit blue. Not all of their body, just their legs, feet, arms and hands. That's because it takes a little while for their own circulation to kick in. Remember, they've been attached to the mommy's umbilical cord, to the placenta, and all of that oxygenated blood has been pumping around the body. But now once the cord's cut, the baby needs to do all that himself. So if you notice blue arms and legs, don't be concerned. It's all perfectly normal. What we also expect with a Caesar is that when you go into theatre, you're going to have an intravenous line put up, which is really just a needle that's inserted into your vein, and they don't leave the needle in. The needle's then removed and a thin cannula is left in, and we need that so that we can have access in times of emergencies in case you need to be given medication, and also to give you intravenous fluid to keep you hydrated and in case your blood pressure drops, and in very rare cases to give blood if there is an emergency or any hemorrhage. You will also be given a urinary catheter. A urinary catheter will be inserted in theatre as soon as you've had the spinal. So you'll arrive in theatre, the IV line will be put up, You will then have a spinal, which is an anaesthetic that's inserted into the lower back, just a little bit higher than lumbar region 4-5. And what they do is they will first numb that area. It might burn slightly, and then insert a needle, but that needle does not stay in your back. The needle is then taken out, and a small cannula is left in. Sometimes that is more with an epidural. With the spinal, they would just give you a once-off dose and take the needle out afterwards. So once you've had the spinal, you might feel a warm sensation really from just below the diaphragm down. And as that is happening, you're actually starting to feel a bit numb, which can be a bit of a strange feeling. You will immediately be put onto the bed, and then a urinary catheter will be inserted. This will not hurt you at all. This is just to keep the bladder empty. And we need to keep the bladder empty so that there's no chance of the bladder rupturing or a full bladder getting in the way of the surgery or the baby's head pressing on a full bladder. So it's very necessary to have this done. Everybody in the theatre will be there for you. Everyone is an expert in their field. They will be guiding you every step of the way. Once you are on the table in theatre, you will probably be looking up at about 9 people. That's your gynae, your gynecologist or obstetrician's assistant, the scrub sister, the anaesthetist, the pediatrician. There's a floor nurse, and very often a nurse assisting the pediatrician. And then, of course, you've got your partner. Under very special circumstances, you may be allowed to bring in a doula, which is a support person for the birth, and that doula will be there to assist with the skin-to-skin. You need to have a look what your hospital policy is and just discuss with your doctor if they would allow that. As soon as they've started the surgery, from when they do the first incision, and sometimes when they're making that incision, you might smell, it almost smells like burnt fly that's caught in a lamp, and that smell is just the smell of the incision being made with a blade that has got heat on. So the doctor will press onto a little, almost I guess, a little device that he pedal, and then the heat will come through to the blade and he will make an incision, and sometimes a bit of smoke can be seen. So don't be alarmed if you smell anything that smells like burnt flesh, or if you do see a little bit of smoke. Simply all normal. Occasionally, while you're lying flat on the table like that, you might feel a little bit nauseous and a little bit shaky. It's a combination of all the hormones, the medication, the overwhelming feeling that you have with everyone watching you, the excitement of being about to meet your baby. You need to be reassured that everybody there is going to know exactly how to help you. So if you do feel nauseous, just let them know, and they will immediately give you some medication into your intravenous line. Once they've made the incision, from that time to when the baby's out is usually just a few minutes. They're going to cut through the skin, sometimes pull a little bit on the muscle. They need to cut through all the layers to get to your baby. But this doesn't take too long. And while they're doing this, you are going to be staring up at the anaesthetist and your partner, just waiting for this amazing moment of meeting your baby. Sometimes the anaesthetist might lean over you to put some pressure on your abdominal area. And don't be frightened if this happens. If you're a little bit claustrophobic, it can be quite overwhelming. They're really just assisting to get the baby into position for the doctor to help remove the baby safely. Once your baby has been taken out, you are probably going to have to wait another minute or two because they will be doing some suctioning, which is just not very invasive, but a procedure where there's a thin plastic tube that they gently put down your baby's nostril or mouth to suction out any excess fluid. We need to do that because we don't want that excess fluid to go into the lungs. Once that's done, they're probably going to take your baby and pass your baby to the pediatrician unless you have asked them to have the baby brought straight to you. Once your baby's on your chest, you are able to touch your baby, but with a blood pressure cuff on one arm and an intravenous line on the other, it might be a little bit difficult. So you will be able to at least see your baby and look into their beautiful eyes. There's just a few things to remember. Occasionally, you may not be able to do skin to skin. And I'm not sure if I mentioned earlier, but skin to skin is where you get to hold your baby with no towels on, straight onto your chest. And this is a wonderful way to get the baby's temperature up to where it needs to be, to keep the baby calm, and just to feel that you're close to your baby. So emotionally, also wonderful for the moms. There are instances where the baby will need to be taken away for a short while. What happens in those cases is the baby will still be in the room, the pediatrician will be examining him and probably giving a little bit of oxygen just to pink them up. What we do in the first minute and the first 5 minutes is we allocate a score out of 10 to your baby. And this score was named after an anaesthetist, Dr. Virginia Apgar. And we are allocating a score for respiration, breathing, heart rate, color, reflexes, and muscle tone. So in summary, a score of 9 out of 10 in the first minute would be considered perfect. As I mentioned that their circulation takes a while to kick in, they'd probably be a little bit blue in their extremities. And a score of 10 out of 10 at 5 is perfect. So we would expect that the score after 5 minutes would be 10 out of 10. Occasionally, babies need a little bit of help, and in those instances, the reason why we have a pediatrician present in theatre is to be able to take over and do whatever's necessary to get their APGAR score up to where it needs to be. All babies are given a small injection of Caesarean at birth, and this is to prevent any bleeding problems. The Caesarean has been well researched and is absolutely worth having. The injection form of Caesarean is considered much better in terms of its results than the oral form. Babies will also be given identification bands before they leave the theatre. The partner's role is for you to make sure that that is correctly put onto your baby with the right name and that no baby leaves the theatre without identification bands. Some hospitals will use bands, others will use a little plastic sticker on the back, and some will use perhaps a little tag system. But you really do need to make certain that it's your baby. Although it's very rare that anything will happen, it's necessary. While you are lying on the table and the doctor is busy examining your baby, it is possible that your blood pressure may drop. This doesn't happen to everyone, but it is quite common with all of the medication you've had and lying in that position that you might feel lightheaded. If this happens, just immediately say, I don't feel well. Although the anaesthetist is well trained to pick that up very quickly, you still need to find your voice and let them know. In those times, they will give you medication immediately and probably some extra fluid via the intravenous line you already have, and you should feel better very quickly. I would also like to stress that no surgeon is going to start the Caesarean section without making certain you can't feel. So once the spinal block has been inserted and they are ready to start the surgery, they very often will spray a very cold solution called ethyl chloride all over your abdomen and ask if you can feel it. If you can feel it, you need to say so. If you're nervous and you just say you can feel it on the off chance that you can't feel it, but you really are scared, please don't do that because it will lead to them giving you extra medication. And if you have extra medication during a spinal, it can easily anesthetize your lungs and you can't breathe. So the spinal is worked out very carefully on your weight and height. And that's the one time you don't lie about your weight, ladies. You need to tell the anaesthetist what your weight and your height is. And often they will do it when you arrive at the hospital. Once you've had your surgery, they still need to suture all those layers, which is why a Caesarean section has such a long recovery rate. We need to suture the uterus, suture the layer, suture the skin. So you've got to be very, very careful post-Caesar not to overdo things. And that's why we prefer you not to drive the first 2 to 4 weeks. Some doctors go so far as to say 6 weeks. No driving, no heavy housework, no bending to pick things up, and being very careful on stairs. So while they are doing that suturing, If your hospital will allow it, and if they have a policy on skin to skin, they can perhaps let you hold your baby in the theatre. But if it's not allowed, you can maybe negotiate that your partner can go into recovery room and take off his shirt and put the baby on. So either mom or dad or partner can do skin to skin, and it's just such a wonderful, wonderful way to bond with your baby. Once you've had your surgery, approximately an hour, when everything's finished, you'll be taken through to the recovery room. In the recovery room, they'll be monitoring you very closely, sometimes every 5 minutes, other places every 3 minutes, some every 10 minutes, to check for bleeding, check your blood pressure, and to check your heart rate, and of course, how you're feeling. So a lot of medication is given during a Caesar. These days we give a standard 1 gram dose of antibiotic. So most Caesarean sections will cover themselves with an intravenous antibiotic, just in case, to prevent infection. Although it's a very clean, sterile environment, and everybody's done their utmost to make sure that the procedure is done in a sterile way, the antibiotic is just to be extra certain that there's less risk of infection. Not only will you be given an intravenous antibiotic, but a medication will be put into the intravenous bag to run into your vein that will help your uterus to contract. This is called pitocin, it's synthetic oxytocin, and the reason this is given is we want your uterus to contract and expel any excess blood clots. We know that post-Caesar, there is still the risk of bleeding, which is one of the reasons somebody will be checking your pad and having a look down there. Every single time they check your blood pressure, they're going to have a check to see that you're not bleeding. You should never be left alone post-Caesar without a bell in your hand. You need to ring that bell if you feel faint, nauseous, unwell, or bleeding. Remember, you're numb from the waist down. So as soon as you start getting feeling back, which can be in a few hours, some people within an hour it starts coming back, others longer, you need to start moving your legs in the bed to prevent any clots. The longer your legs are still with all that fluid pooling, the more risk of deep vein thrombosis and clots forming. So post-Caesar, you can expect to feel a little bit tired, perhaps a bit overwhelmed, quite possibly a bit emotional. And a lot of the time, moms feel not certain what to expect, especially on the pain front. You've had big surgery, and now do you take the pain medication, don't you? You've got this little baby you want to hold, and you need to feed, and everyone's pressurizing you in the first hour to get the baby to latch, because we know that babies that latch well in the first hour, maybe 2 hours, they go on to breastfeed very successfully, usually. So the important thing is not just to get the baby on the breast, but that your pain is well controlled. Once your pain is well controlled, you can go on to enjoy your baby and to feed well. So you will be given, more often than not, an opiate, which is really morphine or pethidine, usually one of those two, in an infusion. A lot of the doctors today, or anaesthetists, prefer to give patient-controlled analgesia, which is where you're given a pump in your hand that you can press every time you need to. Very safe, it has a lockout, so you can press it whenever you feel you have pain. More importantly, you need to let your doctor or the nursing sister who's coming around to ask how you are know what your pain level is, and they should be scoring that out of 10. If it's a 10, you need to sort it out as quickly as possible. Don't be afraid to take the medication. Yes, a tiny amount might come through to the baby, but it's much more important that you're comfortable so you can breastfeed successfully and recover well. During the recovery stage, many moms start shaking. Sometimes that shaking can be quite severe, very overwhelming, because you're not expecting to have surgery and then start shivering. This shivering is a combination of factors. One of them, you might be cold. It's very cold in the theatre. Secondly, overwhelming hormones. Thirdly, the medication, the reaction to the medication in your system. Fourthly, you've just had a baby. Quite a lot of feelings go with that. So if you are shaking and it's really starts to get a little bit harder, the shaking, Just know that everybody in the room is aware of what to do. This is not considered an emergency. You simply need to say, I'm shaking, if you feel they're all busy doing something and not looking at you. They will then, more than likely, put extra blankets on you. Sometimes they have a special heated blanket that they will put on top of you and just reassure you that this is going to go away in the next few minutes. Usually doesn't last much longer than a couple of minutes. In those cases where it does, it's great to have someone next to you. Ideally, this is why I recommend a doula to all my moms. A doula, a caring person who's there just for you to see that you have a great birth experience. Now, other things can happen during the Caesarean section, and even though we like to think that emergencies don't happen, occasionally they do. During surgery, if you're feeling anxious in any way, or if you start feeling that your breathing is not normal, we call it hyperventilating, but if your breathing starts to get faster and you're suddenly feeling panicky, you need to tell the anaesthetist immediately. What they'll do is they'll give you something to help calm you down. But what we don't want to happen is for you to get so anxious that the anaesthetist and the surgeon decide that it's safer to do a general anaesthetic or to put you to sleep. If you have underlying anxiety or depression and you're on medication specifically for this, it's important to be honest and to let your doctor know. As before you go into theatre, we can give you something under the tongue just to help calm you. During the theatre, if things change and there's an emergency and we need to get the baby out very quickly, and let's say there's no time for a spinal, the spinal takes a good 10-15 minutes to set up, you may need to go under or have a general anaesthetic to put you to sleep. If this happens, please know that everybody in that theatre is going to make absolutely certain that they do their best for you and that when the baby's born, they receive the best care. They will only do a general anaesthetic when they are concerned about the health of the mom and baby. It will only be done under those circumstances. If a baby, for some reason, is born and the oxygen levels are low, or we're worried about the baby's health or condition of the baby not looking as good as we'd like it to be, there are occasional situations where the baby may need to be rushed to the intensive care unit. If this happens, give your partner permission to go with. Discuss this beforehand. If the baby's taken away to be seen to by the experts, you want your partner to follow the baby to the ICU unit. Under these circumstances, having a doula would be amazing for you because you'll have someone with you to guide you and talk you through what's happening. Everybody in the theatre is busy with their job. They all have a role to play. And unfortunately, there's not always the time to let you know exactly what's happening in an emergency because they're trying to save your life or the baby's life, and they're doing what they need to do best. Have a doula next to you and ask her to find out how the baby is and to come back with pictures. You are allowed to take pictures of your baby in the ICU, no problem. What might be a problem is if you're filming and in the way of the staff doing their work. Under those circumstances, I would perhaps not film. I would advise that just pictures are taken, and then you can perhaps see a picture of your baby until you meet up a little bit later. The policy generally is post-Caesar, once you've gone to recovery, you would then go through to your room, and if the baby's well, it will go with you to your room and stay next to you in a little bassinet. If the baby is unwell and they're worried about your baby's health, then baby will be in the ICU and you can ask to be taken through later. Because you're not able to walk yet, due to the spinal anesthetic, your legs are quite numb. I would suggest that you don't get up for the first at least 12 hours. And the first time that you do get up, you've got two people with you. So, for example, your partner and the doula, or a nurse and your partner, because the first time you get up, you can be very shaky and a lot of blood is pooled in your uterus, so you might have a gush of bleeding. You also might have a blood pressure drop from being in one position for a long time. So never ever to walk the first time without assistance. In an emergency Caesarean section, it can feel incredibly overwhelming because no one plans to have an emergency. But what we do know is whether your baby is born naturally or whether your baby is born via Caesarean section, the most important thing is that you have a healthy baby and that everybody has worked together to see that your health and the baby's health has not been put at risk. Moms can love their babies just as much no matter how they're born. What determines a happy and healthy baby is the love you give them and the time that you spend with them. So please, we don't want you to feel in any way disappointed if you do not get that perfect birth that you had planned. It's perfect already. You've got your baby and that is what counts.